Hey, my name is James Dre, physical therapist student at Jeff State, and today I'll be talking to y'all about dementia. The reason I chose this topic is because during my time at clinic, I thoroughly enjoy working with the older population, the geriatric population, and that's normally the population that you'll see experience dementia. So what is dementia? Dementia describes a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with one's daily life. It isn't a specific disease, however, several different diseases may cause dementia. Types of group based off common symptoms. Dementia is caused by damage to or loss to nerve cells and their connection to the brain. Depending on the area of the brain that's affected by the damage, dementia can affect people differently and cause different symptoms. Overall, dementia is seen as a global decline in day-to-day function. It's a global cognitive decline, and it's no known cause. However, it's believed that genetic factors and abnormal cellular processing in the brain leads to the development of dementia. So, changes that occur with dementia. Memory loss and communication deficits are normally most pronounced and seen. These patients may experience motor planning difficulties, and often the most evident sign of dementia and the most telltale sign is decreased critical thinking abilities. These patients lose the ability to solve complex problems. Like if you ask them what's 10 minutes before 11, they may have difficulty telling you what time that is. In the latter and middle stages, these patients experience spatial and visual deficits and confusion and disorientation. During my time in clinic, I actually enjoyed working with those patients that were kind of confused and disoriented because they were often pleasant and nice to work with. Psychological changes that occur are personality changes and depression. You don't have a patient who was normally pumped up and excited, very talkative. This patient may become down, sad, not have much to talk about. These patients often experience anxiety because their life has changed in a matter of months, days, or a year. Like just last year, they may have been working now, like they can't work a job anymore. They're in a facility living, so anxiety and depression, are changes that dementia may cause. These patients may also experience inappropriate behavior, especially in clinic. They may be sexually inappropriate or racially inappropriate, so you have to refocus the therapy and make sure you document those things when they occur. And agitation and paranoia and hallucination is very often present. These patients often, don't know if you're there to help them or not, and they can't tell that you're there to help them. So there may be agitation, aggression, and that paranoia. They may be hearing or seeing things that aren't there, so you have to be prepared for that when working with these patients. So who's affected by dementia? Dementia affects about 25 million people worldwide and 5 million people here in the U.S. With the rise in life expectancy, this number is expected to double every 20 years. For food for thought, with patients 65 and older, 6% of these patients have dementia. When they're 80 years or older, 20%, and at 95 years, 95% of patients have dementia. So who's at increased risk? Those people with increased age, basically 65 and above, family history, mom, dad, sister, brother have dementia, it increases your risk. And those with Down syndrome, around middle age, these people start develop dementia-like symptoms, and that's due to their baseline mental ability already being, at a deficit. So risk factors that can be changed. Diet has an important factor in development of dementia. It's been shown that people with Mediterranean diets high in fruit, nuts, and proteins have a decreased risk of developing dementia. Exercise is very important. A sedentary lifestyle increases your risk of dementia. Alcohol use. Heavy alcohol use has been shown to increase the risk of someone developing dementia. However, moderate use has been shown in research to have a protective effect on the brain from dementia. Smoking increases your development due to the blockage of those arteries, and it may affect that cellular processing in the brain. And uncontrolled diabetes is a risk factor that can be changed when it comes to managing dementia. Cardiovascular disease such as hypertension, high cholesterol, and fatty buildup in the arteries increases the risk. and that could be changed by diet and exercise to decrease the risk of dementia. And those of sleep apnea. When you have sleep apnea, you have periods of sleep where you stop breathing, and that's a reversible memory loss. However, it's believed that this reversible memory loss leads to the development of dementia. So medically, there's currently no cure for dementia-like diseases. Normally, a decline from previous level of function is the most common sign. The progression of dementia is continuous, and screenings are used to provide a baseline. Screenings such as the MADRS Dementia Rating Scale, the Mini Mental State Examination, and the short test of mental statuses. From a physical therapy standpoint, balancing gait training in the early stages are very important. You want to maintain the mobility of these patients. Strength training is also very important. Strength training is a very important component of balance. So keeping these patients balanced and safe when walking and doing activities is very important. You want to maintain that range of motion, especially in the trunk and their distal extremities, so the patient can maintain function as long as possible. Caregiver training may be needed for caregivers in latter stages, on transfer training, gait training with the patient, and just regular caregiving, such as rolling, bed mobility, things of that nature. Orthotic devices and assistive devices may be assigned by PT or PTA to assist these patients with walking and safely maneuvering in the environment and the community. And in the latter stages of the disease, a wheelchair is normally needed for these patients to safely maneuver in the community and ambulate. These are my references listed here. Thank you all for listening to me. Bye-bye.